Now let's discuss about antithyroid drugs. Thienamides possess a thiocarbamide group that is essential for their activity. They prevent the synthesis of thyroid hormones by competitively inhibiting the peroxidase-catalyzed reactions necessary for iodine ramification. They also block the coupling of iodotyroxines, especially diiodothyronine formation. Their onset of action is delayed until the performed hormones are depleted, a process that may take 3 to 4 weeks. Thienamides may be immunosuppressive, but this is controversial. Carbimazole is rapidly converted to methimazole in vivo. The aim is to render the patient euthyroid and then to give a reduced dose for maintenance. It is often possible to cease treatment after 1 or 2 years. Side effects include rashes and, rarely, agranulocytosis. Propylthiouracil is usually reserved for patients intolerant to carbimazole. It is associated with a higher incidence of agranulocytosis. In addition to inhibiting hormone synthesis, propylthiouracil also inhibits the peripheral detonation of T4 and perhaps has an immunosuppressive action. Iodides have several poorly understood actions on the thyroid. They inhibit organification and hormone release. In addition, iodide decreases the size and vascularity of the hyperplastic gland, effects which are useful in the preparation of patients for thyroidectomy. In pharmacological doses, the main effect of iodides is to inhibit hormone release, possibly by inhibition of thyroglobulin proteolyses, and because thyrotoxic symptoms are reduced relatively quickly, iodine is valuable in the treatment of thyrotoxic crisis, thyroid storm, a life-threatening acute exacerbation of all the symptoms of thyrotoxicosis. Propranolol or atenolol can reduce the heart rate and other sympathetic manifestations of hyperthyroidism and provide partial relief of symptoms until full control is achieved with carbimazole. It is useful in the preoperative preparation of patients undergoing thyroidectomy. Propranolol is also used together with hydrocortisone, iodine, and carbimazole in thyroid storm. Now, let's discuss replacement therapy. Levothyroxine administered orally is the treatment of choice. Synthetic T4 is the sodium salt of levothyroxine. Its effects are delayed until the plasma protein and tissue binding sites are occupied. Treatment is assessed by monitoring plasma TSH levels, which fall to normal when the optimum dose is achieved. Levothyroxine is the sodium salt of T3, and because it is less protein-bound, it acts more quickly than T4. The main use of T3 is in hypothyroid coma when it is given by intravenous injection. So that was all about today. Keep following sqadia.com for more such videos.